And ready to go.
All right, that'll work. Hey guys, how's it going? It's Ray Lynch. I'm a physical therapist. I'm here with Aaron Fick, and I'll let him introduce himself in a minute. And today we're going to be talking about the topic of warming up and cool downs. What do we agree on? What do we not agree on? Right. So Aaron being more in the fitness side of things, and now kind of evolving even the last couple of years into doing some other things. And then me on the medical side of things, what do I think about it, right? So what about the individuals with injuries? What do we need to be doing there? So, and this was something that we don't know. We may agree on a couple things, we may disagree on a couple things, but I thought it would be good to at least open up the dialogue. So, Aaron, I'll let you introduce yourself, man, and then I'll kind of say a couple points on what I think, and then we'll just go from there.
Yeah. So, again, Aaron Fick, strength and conditioning specialist by trade and name. Been about 10 years in the field. Most of that time hands-on in the trenches, and have just recently transitioned over to the clinical side of the house.
So guys, warming up and cooling down I think is an interesting topic, because I think you hear a lot of different things, right? As we grew up, it's, hey guys, you're in the weight room, or we're going to play baseball, like let's go do some static stretching. And so if you're not familiar with the term static stretching, static is, hey, hold this position for 30 seconds, or hold this position for a minute, or whatever. Hold this hamstring stretch, right? And so we kind of grew up with this, do this, and then get into some of these sports-specific activities, or just go play, right? Depending on the level of coaching or level of personal training, or, coaching wherever that you've had in the past, you've had your different encounter with this. And for me, when I first started out, I was a personal trainer for a couple of years. My answer back then would have been a whole lot different than what it is now. And I think that goes with A, more education than I did when I was 18, but also B, the research and the information out there has changed. So I'll kind of give my opinion. Cool downs, to be honest with you.
That's about it.
I mean, so for me, guys, and I don't want this to be an opinion. So for me, my opinion is, that's it. I don't really think they're beneficial. The main thing behind this, in the past was, well, let's kind of get everything back to resting. Let's get your heart rate back to resting, your blood pressure back to resting. Some of these tests, so the YMCA step test and a couple other ones, I believe it's YMCA or Harvard step test. It's been a couple years since the exercise science stuff, but you're actually looking at recovery heart rate as a matter of fitness level, right? And looking at recovery. And I think we've had this emphasis on that for cool downs per se. So I'll separate recovery and cool down. But cool downs, guys, doesn't really do a whole lot. I mean, even fitness, no, I haven't seen it. Golf, no, haven't seen it. Tennis, no, haven't seen it. What I would say is a warm-up is more important. Would you add anything to that? I'll add a research article to it because I looked it up because of my opinion. But would you add anything to that?
Yeah. So I'm glad you start with cool down, because we can knock out cool down real quick. What I would add to it is, again, going back to fundamentals is where I always draw from. Fundamentals doesn't mean basic or simplistic. It means things that we cannot overlook and that have to be built upon. So fundamentally, biologically, we are a homeostatic species, right? We are very good at auto-regulating and coming back to home plate. And cooling down is essentially one of those things. From my side of the house, the fitness industry, cool downs and warm-ups both, there's a big sales pitch for them. And so this is where a lot of the, I wouldn't say evidence, but a lot of the fads are out there with what to do to cool down. People want a lot of talking points to have. People want a lot of, intellectual crowning, if you will, on these points, but there's not a lot of substantial evidence to a cool down, and it's important that we get away from all these complexities to cool downs and stuff, because anytime we go down these routes like this, it really undermines the human species. Like this obsession with cool downs, this obsession with warm ups, really takes on the mindset that we're a fragile species, that we need so much to do so little, and it's just not the case. I mean, a hard session of training, or even rehab for that matter, whatever the case may be, once that bout of stress is over, within minutes, within hours, you're going to be at a homeostatic position again. Especially with stretching and things like that. I mean, stretching's majority neurological rather than anything structural happening, but even though then those subtle temporary changes from a cool down, even those go away after several minutes and several hours. So the body just doesn't have a huge response to cool down outside of a coach or somebody trying to sell something to you. That there's just not a whole heck of a lot that needs to be focused on there, I think, in any setting. But from where I can speak, fitness setting, performance setting, strength and conditioning setting, strength and conditioning and the performance setting is really where this cool down and warm up stuff tries to get really fancy and advanced. But from a cool down standpoint, the evidence isn't there, and we shouldn't expect it to be there because we're not that kind of a species. We don't need 1,000 things to do one thing. So
exactly. No, and I agree with that. And I would say, because you kind of said across all settings. Now, guys, it's not to say, guys, that there aren't special populations that need to be at least assessed during this period or may need to have some kind of at the end, right? So you don't just make them do a whole bunch of cardio, say they have some kind of heart condition, and then you say, all right, you're good. If they have those things and you need to monitor it, guys, and you're a physical therapist or medical professional, obviously in those special populations. I think we're talking more along the lines, like you said, of the just general fitness population, strength and conditioning, and actually most of the time in an outpatient setting in physical therapy. I cannot say it as a blanket statement to apply to anyone in any setting, but in general, I think cool downs are just like you said. It's just a buzzword. Let's do this. Let's do some foam rolling because we're going to add that on because, hey, here's what we have at our gym. So I would agree with you. I don't think it helps. When it comes to performance, right? So I work with golf athletes, with tennis athletes. So that's where I was like, you know what? My opinion, my bias, based on what I've looked up in the past is, well, it doesn't work. So I looked up a couple things, and that's mostly what it said. I mean, even the new research is like, it doesn't work. Don't do it. But there was one that was actually interesting, and it actually brought up, I'll have to see it real quick, but it actually brought up that if you did a cool down, then actually performance the next day was a little bit better. Let me find this, because if we're going to say this, then let me say it, right? So, okay. So this one here showed that if you did, that you would actually decrease, if you did it afterwards, you would decrease the negative effects of basically working out, negative being soreness, but the next day.
Sure.
And honestly, guys, consensus, it says that's not the case. There is no change the next day. There are some control trials that say, randomized control trials that say yes, but the majority say that they don't. So if you already are doing cool down, we're not saying don't do it. You're an idiot. You're wasting your time. It's not really fundamental, like Aaron said. So it's not necessary, but there's not a whole lot backing it up. Now,
right. I think to go off that's the biggest thing. We don't want to be senile about this. It's not saying like, hey, don't cool down. It's just don't. we don't want you jumping overboard and falling for all of these special programs that you can buy into and things like that. Just if you're cooling down, it's working for you. It's part of your routine. It's habitual for you. No harm, no foul. Just when the narrative becomes, hey, this is better for you, that's
sure. Yeah, I think that's a better way of saying no benefits. Because I think, again, like you said, if you're in the routine, it feels good, you like to do that at the very end, relaxes a little bit, decreases stress, that's beneficial in and of itself. When it comes to a soreness or performance, there's not a lot of literature out there. So yeah, don't hear us as saying, don't cool down because it's bad for you. Just don't make a decision based on, I'm going to go to this gym because their cool downs are a whole lot better. I need to buy into this program because the cool downs are a lot better, guys. So we'll just take it right into the next topic, warm-ups.
Yep.
So I'll let you start this because I'm getting the feeling that we're going to be a little bit different here, which is actually good. I like that conversation. So let's do it. I'll let you start yours and I'll give my opinion second.
Yeah. So warm-ups, again, strength and conditioning, performance setting. If cool downs have a lot of wild things out there to it. The warm up side has tenfold that, and this is a good chance for your coaches out there to kind of again show off and talk big words and say a whole bunch of potentiations that they're doing and activations and this, that, and the other. And with warm ups, the fundamental that we need to get down to, that the best warm up that I see out there that I can put a blanket statement on is essentially your ramp protocol. So raise body temperature, activate, mobilize, and then potentiate. Now, almost everyone agrees with that kind of a consensus. It's how that's approached can be a lot different. And I think in the strength and conditioning world, this is overlooked, or not overlooked, but over applied, and the nuances of it and the extreme detail become so focused that they forget that this is almost inapplicable to what they're about to do. So I'm putting all the backstory there because essentially the biggest thing that we have to correlate with injury prevention in terms of trying to focus on warm-ups is a lot with just the specificity to what you're about to do and a gradual increase. That's almost conclusively across the board like the A1 priority. So with that, though, there's a lot of routes that are taken. I'm not a big fan of foam rolling. All these things that I'm going to name off, there's nothing inherently bad with them, but again, it's just not adding any sort of benefit from my standpoint. With foam rolling, the best literature we have out there is essentially getting some elasticity going, a little bit of blood movement. That's true and that's correct, but however, that can be done with any other 1,000 exercises that can kill two birds with one stone. So to kind of make this more specific to what I'm saying, we'll give examples. So if squatting is the athlete's chore for the day, if you will, or sprint, whatever, what we're going to have them focus on is squatting pattern movements, right? And we're going to start at a completely unloaded. They're going to practice the pattern. This is a good time for me as a coach to start honing in, queuing things up. They're going through the movement pattern, and this essentially covers the entire ramp protocol without getting overly redundant. Because of the repetition, he's already raising temperature. Because of the specific movement, he's mobilizing to that specific movement, right? A lot of mobilization drills are ineffective if they're not specific to what you're doing. A sit and reach stretch for the hamstrings isn't going to have a whole heck of a lot of transfer to the squat. It's just
agree that one doesn't really work a whole lot anyways. For performance.
Right.
I'll agree with you there. I'll let you continue, but okay, go for it. Static stretch. I'll just say my piece. I don't think
Right.
If there's research. I'll present it. I step back. Sorry.
Yeah. So, essentially we're focused on the actual movement that we're going to perform. So air squatting, leading into empty bar sets, leading into a gradual increase in load. This takes care of the entire ramp protocol with raising temperature, mobilizing, activation, and potentiation. These are the keywords out there that really get overhyped to the point of a little bit of frustration with me. This is where strength and conditioning coaches will add in all their kind of flair and flavor to highlight themselves and do a bunch of crazy activation drills.
Sure.
But they have no translation or no bearing to what's going on. So where I want to focus is activation, potentiation, and then a little bit on foam rolling, just because these are hot topics out there that I think just get overhyped. So activation, potentiation drills essentially, not necessarily isolating movement, but they can isolate a muscle group and they want to activate the glutes for the squat or whatever, or potentiate it by performing something similar to the movement in an aggressive manner to kind of have an excitation effect.
Sure.
And again, yes, it happens. Transferability, minimal. And two, I would almost mitigate that because it's of no better effect than just practicing your movement. So going through a squat pattern is going to activate everything that you need. As you gradually increase loads, you are increasing that activity level and you're potentiating everything else. So essentially, we're just trying to, my mindset is to get away from this overhype and this over exaggeration that just isn't necessary with activation potentiation. If you're getting ready to go on sprints, focus on a running warm up. If you're getting ready to squat, focus on a squat warm up. Spending 10, 15 minutes of isolated activation movements, a whole bunch of potentiation, a whole bunch of non-specific stuff that could be better spent coaching the athlete in the movement and then leading into the movement itself. Is where I see it. It's not it's more efficient for me as a coach, and again, it gets away from the flashiness that I'm not too big of a fan of. Foam rolling, there's a whole bunch out there on foam rolling. I mean, right now it's foam rolling can cure cancer at this point.
Yeah,
but the biggest thing, the only hard evidence that I've been seeing with foam rolling is a little bit of elasticity and a little bit of blood movement.
Yeah, and I've seen basically research studies that say, yeah, but not really too, right? So
yeah.
I think it's one of those where it's a mixed bag at this point.
Right.
Especially if someone tells you, hey, we're rolling out the IT band or we're doing this or we're doing that, guys, like, hey,
right. So to present the strongest argument, I think I'll start with presenting the strongest argument for foam rolling because that way, one, it takes my bias out of it a little bit, but even then the strongest argument doesn't have a whole heck of a lot of effect. So it is to warm up the tissue a little bit. It's local and specific. So obviously if you're rolling the IT band, it's going to add some elasticity there. But this is extremely short-lived, right? This again, the body's extremely homeostatic. So once this rolling is complete, if you're not moving or doing what you're supposed to be doing within several minutes, like I think the research was pretty specific with it, like 5 minutes,
Yeah.
5 minutes, you're back to. They retested. It's as if you never touched that area.
Exactly.
So we kind of kill. Whenever I address these warm-ups, it's never about like they're wrong again. It's about just efficiency. Like you're just not getting a whole heck of a lot out of it. What I do want to make sure that we get across, because this was huge, and I think a lot of the world out there is getting away from this understanding, but I'm surprised to still see it out there, is this understanding of micro trauma scar tissue from exercise and foam rolling being able to break it up. This micro scarring from exercise induced trauma, if you will, just that just doesn't line up with evidence. That's a big logic bridge there. That's, I think, perhaps came from trying to compare scarring from actual, grade 2 and 3 strains, and perhaps they tried to bridge this gap here. I don't know where it came from, but this fact that we develop scar tissue on a micro level from exercise, and then that foam rolling can break up this scar tissue and loosen you up is just, that's where I draw the line. That's where the fallacy is. One, the scar tissue just doesn't exist at that kind of level. If it did, then we would see a decrease in performance as we exercise and an increase of a bunch of boluses of scar tissue all over the body. I mean, it's kind of a self-defeating argument there. But two, even if we did give way to this narrative, scar tissue is extremely, extremely tough. I mean, it's like second to bone, right? There's a very strong tissue there, and to assume that a piece of foam rolling over it can break this scar tissue up, again, one, isn't supported by the literature, but two, we got to take this into reality. If a foam roller could break up some scar tissue, then I guess if I placed a 400-pound steel bar on my back, it's going to cut through me like a knife and butter, right? It doesn't line up there. So the narrative that foam rolling is going to do a whole bunch of mobility work for you just isn't there, and that scar tissue narrative. I'm not sure where it came from, and I'm interested to where like the origins of it came from, because I just don't see it out there.
I think the origins more or less come from. I don't think the origins come from so much of a we get the micro trauma and the micro scarring of the muscles. I think that's one of them out there, but also looking at myofascial adhesions, or even adhesions between the fascia and the skin.
Right.
And those things have led to, okay, well now, because the fascia compartmentalizes the muscles, now things aren't functioning quite as well. And I think that's where they kind of went. And I think that's where physical therapy has taken it, in the sense of, look, like if we've got X patient with this, we're going to try and address the fascia, the skin, and get things basically calmed down so we can get in and mobilize it a little bit more and get you moving better. I think that's the approach that it's taken. I would agree that the research isn't out there. Guys, what I would say is we're talking warm-ups here. And I think you may be talking warm-up and kind of foam rolling in general.
Yeah.
So I'll speak to it. As a warm-up activity, no, I would agree with you that I think it makes more sense to be getting coached in the activity than using foam rolling as a warm-up. I agree there. In the sense that foam rolling isn't effective at you didn't even say it's not effective at all. You just said it's just not effective, mostly is what we find in the research. And if it is, it's temporary. And I think, guys, in the physical therapy world, the way that we're using it is, and I don't even use it. So I'm more or less just speaking to some of the therapists I know and how they use it. And my mentor in Atlanta didn't use it. He was like, I don't believe in it. So it's even in our field, it is controversial. The belief, though, is that a lot of times, so some people use it for like nerve mobilization, and they use it with the consideration not to mobilize the nerve, but they consider, okay, there's what we call interfaces that interact with the nerve along its path, whether that's fascia or muscle. So in the case of the sciatic nerve, everybody knows the muscle piriformis, right? So the piriformis would be considered an interface. So sometimes what people do if they have a nerve restriction, say coming off a microdiscectomy, or they have nerve-generated pain or neurogenic pain, they will sometimes actually do some things there, either A, with a foam roller or soft tissue by itself, to address the interface to then be able to mobilize the nerve in that short period of time. Right. I don't know that the ones on this side who are saying foam rolling works, I think we all know that it's very temporary. And then the ones over here who say it doesn't work, I think it really depends in physical therapy. It depends on the patient. It depends on the use. I would agree with you 100% that using it as a warm-up instead of doing something specific doesn't make sense. Absolutely. And if you guys have questions about foam rolling below, it's a hot topic. We could go literally for hours on this. And you know what? We get a lot of really good opinions. So if you guys do foam rolling with your patients, clients, whatever, or you do it yourself, I'd love to hear from you.
Yeah. The reasoning kind of drives the blessing off of it. You know?
Yeah. As with anything. And I want to ask you a question, because you got to a couple things earlier that I thought were really interesting, because quite frankly, the strength and conditioning side of things, now, am I in it? Yes. But it'd be like you saying you're a physical therapist. You know what I mean?
Some people do.
Yeah. I can understand some of it, right? And I've been in it, and I can say, hey, I was a personal trainer, but I don't have the same amount of knowledge in that field. So I'm actually interested on your opinion here, because for me, like, say I'm getting someone to go into a squat and I notice ankle mobility restrictions at the talocrural joint. And that's actually limiting their ability to get into an appropriate squat. So no matter how much coaching I give them, they're going into forward flex, or they're staying way back, or just bending whatever, right? They're having impairments that when I look at them, I'm like, they're just not folding. I don't know if it's the talocrural joint. I don't know if it's the gastrococcolius complex. I don't know what it is, but for whatever reason, they're not able to basically translate their tibia over their ankle joint. And so what I was hearing earlier was just do the squat. Would you say there's anything wrong to basically say, hey, look, let's do some talocrural mobilizations, stretch out the calf. Let's do back and forth. And again, I'm not crazy about static stretching, But if we're talking about for a purpose, right? So
Mm-hmm.
mobilize the joint, stretch. Mobilize the joint, stretch. Now go see your squat. And now all of a sudden they don't have the forward flex trunk. Are you saying, and it's okay if you are, because I want to hear you out. Are you saying that's more fluff and we would do better just going into the exercise itself?
Yeah, pending any special pops or orders from a physical therapist or medical doctor or anything like that. I'm still going to take them straight into the squat. One at that point, like, and this is for everyone. When I say we warm up with the squat, everyone's like, everyone across the board. Oh, I'm so tight. Oh, this is tight, tight, tight. And I'm like, 100% correct. Yes, I like when we're starting to warm up. I don't expect to see anything looking good. We're warming up, right? Everything should feel tight. And when I do have my outliers with the ankle stuff, depending on how severe it is, I'm looking more for the long-term effects. So my warm up will still be pretty squat specific. If they're doing something on their own with somebody else, that's fine. But honestly, my focus is going to be making sure that I'm lining up their anthropometrics right. So a lot of times they'll say, hey, I'm tight in the ankles and I can't squat like this, and sometimes I'll simply adjust stance. It tends to be a little wider, tends to be, I'll even change bar positioning and go to a low bar. Some people are just built to have a larger torso lean. And this is where the controversy comes in, to be completely honest, where people will focus on the ankle mobility, and I'll accept that a larger torso lean is completely okay. And when I do that, I'm still going to have the techniques and foundation of the squat perfected. They have a little bit more torso lean, completely fine. What's more important than a heavy torso lean is making sure that wherever that torso is positioned, it is cemented in that position, right? It's not about the torso lean, it's about changing that torso angle when you're moving. That's the issue. So somebody with, if I concede and say, yes, you're tight in the ankles, you're restricted in the ankles, my focus is still going to be on the squat and positioning the squat around them so that we can still get in full ranges of motion, because the priority is to get strength and that full range of motion down. Did I kind of cop out of the ankles? Maybe, but my mindset at that point becomes mature vision, long vision, right? Things like mobilization, those can be permanent fixes when they are chronically exposed long runs. So what I mean is, I'm going to accept a level of immobilization by them, because I know in the weeks to come, after chronically squatting, after chronically working positions, they're going to settle into a good movement. And that ankle mobilization, now instead of having to kind of work on it every day specifically by itself, there tends to be a permanent structural change there. So I'm going to concede, and I still won't focus on specific mobilization, just because I'm going to focus on making the movement fit them, and be okay with a little bit of play as the weeks go out.
Well, and I think that's an interesting approach. I mean, we can agree to disagree on that one to some degree. What I think you brought up, that's a good point, though, is that there are different body types. So just to assume, and so guys, I saw this post the other day. I think Barbell Physio may have put it out, and it was interesting because it was like, look, guys, not every squat looks the exact same. With my tennis athletes, not every tennis serve looks the exact same. There is no perfect, because everyone's built just a little bit different. And so to assume, hey, like this person with this forward trunk angle, they're doing this, that, and the other, like we need to change it. I think there's two camps, and I think that there's a gray area, and I kind of find myself in the gray area, kind of listening to both sides, trying to figure out, okay, where is my opinion at? And I guess my opinion right now is, yes, I think that your body, right, is going to adapt to these changes. But I also, I guess for me, because when you toe out a little bit, that's the body's natural response, especially in gait, is they toe out to basically say, I'm not going to go over that ankle quite as much. If it's someone, for me, I guess, with a history of chronic ankle sprains, grade 2, grade 1 even, and they have some basically changes in there from a structural standpoint, I guess me personally, I would address it, but I don't think there's really anything wrong in just adapting to what they have either. So I think we could agree to disagree without necessarily either one of us being wrong. I think it's just two different approaches.
Yeah.
And I think that's the biggest thing out of this conversation is you may do one thing. I'm not going to fluff them up and say, you got to do these ankle mobilizations every single day or else this is going to be restricted. It's like, no, look, do it when you're about to squat. Keep your feet right here. See if it feels any different, right? So you go down. Do you feel the pinching in the front? But I agree with you too, and I thought you brought up an interesting point. Is that look, when you're warming up, everything feels that way. And so I guess for me, it's a certain population that I think I would address it, but I don't have a problem with toning out a little bit and seeing how they do.
I think I err the way I do. Because I do acknowledge my bias, and I think it comes from I have a fear for the narrative and where it could lead with
and where everyone's
with going down the road of all these specialty exercises, and then we get caught up with doing 1,000 different things when the miracle of just working that movement can happen. And in my experience, it's been a lot of the warm up, the specialty warm up exercises have been, from my position and seeing a lot of inexperienced coaches, it's been the cop out. And what I mean by that is they'll spend 5 minutes working somebody's squat, and then because they don't have the capability yet, or for whatever reason, perhaps they're just not trained up enough, and they're like, oh, you're just not, the cop out answer is you're not mobilized. And they'll say within 5 minutes of coaching them, I'm like, well, I've spent 35 to 45 minutes on somebody's squat. Granted, that's the benefits of one-on-one training, and we can go down that road of team training and all that stuff. But I think my bias comes from just being afraid of the narrative and then being afraid to cop out. I really don't like to give up on movements. I'm pretty. I guess I'm just pretty damn stubborn.
That's the whole point, though, guys. Is you are going to have your biases, but and Aaron, what I would tell you is sometimes it's okay to challenge that. You know what I mean? Yeah. And I think you know that.
Yeah.
And I think and I understand where you're coming from, because you do have coaches out there who cop out and they say, well, rather than coaching this movement up, it's got to be due to this or whatever I learned in my last course. So physical therapists who take these courses, they have that bias towards it, right? So let's just take, we'll go to this really quick, and we're not going to stick to it because we could stay on it for a while, but kinesiotaping, right? They go and they do this kinesiotaping course, which, guys, I'll tell you, that was my bias coming out of school. When they go, then all of a sudden they see everybody through that lens, right? So everyone needs to get kinesiotaped in the fitness and coaching world, right? It's, well, I did this ankle mobilization, so everyone needs it. They start looking for it. And I would say I think it's a good thing that you said, well, I'm not going there. Maybe one day, man, I'll come up there and we can spend some time together, and I may or may not be able to change your mind on some things. But
tell you what, we'll put our own personalized warm-up together and sell it.
No, but you know what, man? It may be one of those things where maybe we spend some time together and address biases on both sides. Because I think we both have them, which would be good. But kinesiotaping, guys, just really shortly, and this is why I was bringing it up, is I had this professor in school who does kinesiotaping on everybody. And if you're watching, she knows exactly who she is. That's okay. I use it for some people. I do. And there's some evidence for some people that it works and in certain conditions, right? So taping works with plantar fasciitis, but you really shouldn't use it with Achilles tendinopathy. It works for some things. But my bias coming out of school was, I'm never going to do it because that teacher said I should use it for almost everything. And I said, I'm not doing it because it's a fad and everybody wants it. And as I started experimenting with it a little bit, I was like, you know what? I actually like it for A, B, and C, but I still don't think it needs it for here. So I think that'd be interesting to address as far as biases go one day. What I want to move on to is warm up for performance. So when it comes to static stretching, so Aaron's kind of addressed the fitness side of things. So if you're a golfer or any kind of other athlete out there, right? I mostly work with golfers and tennis players, and so that's what I'm going to speak more to at the moment. Static stretching actually decreases performance. So all this stretching right before you get out there, not only in the fitness world, but in the golf and tennis world, has been shown to actually decrease performance and basically decrease carry, decrease club head speed. If you're a golfer, you know what that means. And if you're a tennis player, it doesn't really do anything for injury prevention, right? So we're talking, oh, well, you should do static stretching before to prevent injury. There's nothing to show that. It's not saying warm-ups don't to some degree. Static stretching definitely doesn't. Warm-ups are mixed with these sports, guys. It depends. So golf and tennis, if we're talking injury prevention, it's a mixed bag. Okay, I could get into the details, but it's a mixed bag. If you feel like it helps you and you like to do it as part of your routine, absolutely. Now in soccer, there's what we call a FIFA, or I think it's FIFA 11.
Yeah, FIFA 11, yeah.
So the FIFA 11 is really to help prevent injuries, especially ACL tears in soccer athletes, because that's going to be where your highest incidence of ACL tears are each year. And that has actually been shown to have some positive effects. So it's sport specific, similar to what you said with fitness, is that if it's specific to the movement you're going to do, a sprinter should do a running warm up. If you're doing soccer, you should be doing basically the FIFA 11 is what they've started to look at a lot more, and I think even the 11 plus. And golf, guys, golf-specific activities, tennis-specific activities, or warm-ups that act as that. So they looked at golf, so you would think golf. So in your scenario for a squat, right, we'll do some squats, lighter weights, get coached up on it. Actually, in golf, they say you just go out there on the range and warm up, and that actually doesn't help you at all for performance. But if you do like some rotational med ball throws and you do some exercise there's a couple of them they highlighted. If you do a dynamic warm up, an appropriate warm up, not just stretching, guys, but an appropriate warm up followed by golf specific activities, your performance will increase. So that was interesting because I agree with you.
Yeah, so I'll pick up right there. I would consider that still to be sports specific when we talk about the rotational aspect and then the swing being brought in. When we get out of the gym and we start going sports specific, that's where that potentiation word isn't bastardized so much anymore because then it's not overly abused and ridiculous. It's still specific to the movement and you're warming it up. So to kind of give everyone a narrative to understand like why, again, going back to the biology, when we have stretching of all kind is, again, at the immediate effect, it's almost completely neurological. And it's really interesting to see tendons, specifically speaking tendons, the actual malleability of that tendon, of that organ, will change its plasticity right within seconds and minutes. I mean, it's incredible to see it go from completely malleable to just stiffening up, right? Or vice versa, from very stiff to being very malleable. And so when we go and the way these changes happen are from the approach of how we're getting ready to train. So when we go into a very methodical, very slow induced static stretch, we're just melting away that tendon. And when we have that rubberized tendon and we go violent on something, that's where there's a decrease in performance. There's not that hard backbone to transfer the energy. Absolutely. Whereas why we want to be sport specific and gradual, obviously, again, the elasticity, there's not a lot of tension there to transfer that energy. So we want to start small. We get a little bit more tense. We add a little bit more intensity. We tense up even more. And so essentially we're just stiffening that board to be able to transfer that energy and transfer it specifically to the sport, the weight room. And thus from that's where that injury prevention is going to come in, is we're tightening up the body, one in general, and two specifically to that movement.
Yeah. Well, and guys, just kind of to cap it up, I know you got to go, but just to kind of recap everything that we've been talking about, we've been talking about static stretching as it relates to the warm-up and cool-down. ACSM has some information out there, guys, especially for special pops, that flexibility should be done even if it's static positioning, and we could talk about that later, or you can put in your 2 cents on that. I know there's they recommend some static stretching at least, 5 days a week, 7 days a week, 5 to 7. So there's some of that out there. We're talking more we could go down that hole, but we're talking more in terms of, does it help prevent injuries? Does it help performance? And what we're saying is, no. When it comes to cooldowns, in recap, guys, it's not that cooldowns are bad. We're not saying that. If it's part of your routine, go for it. But there's no substantial effect. You're not going to decrease the amount of lactic acid that's in your muscle. You're not going to decrease delayed onset muscle soreness or DOMS. You're not going to there's really little research to say that you may improve performance the next day, and that's a mixed bag. If it's part of your program, go for it. Warm up, I think we would both agree on, it needs to be specific to the activity. Don't just do a whole bunch of random stuff and expect to have changes. If it's sports, it needs to be sports specific. If it's fitness, it needs to be lift specific. And don't go crazy on all the foam rolling right before, because quite frankly, you may or may not get it. Foam rolling, guys, again, if you listen to the video, you know I said this. I don't think foam rolling is inherently bad. I think it's been overly applied. And I think in the right hands, in physical therapy, there's two camps. But I think it really just depends on who you're using it for and why you're using it. But in the fitness world, I don't know that it really helps from a warm-up or anything standpoint, any more than getting out and doing the activity would. Right. I think I pretty much recapped it. Would you add anything to that, man? I know you had
that's it. So the biggest thing is like don't sell yourself on a warm up or a cool down, right? It's just that. It's 5 minutes, it's getting going. What you're there for is your sport. What you're there for is your workout. That should be taking the majority of your focus. That should be taking the majority of your concentration, your energy, your recovery efforts, all that. Warm it up to get to where you're going, and then cool it down if that's your thing. Or grab your bag and grab your clubs and go home. Like it's straight to it. Don't let anyone try to sell you a narrative.
Yeah, exactly. Well, all right, guys. Well, Aaron, I appreciate your time, man.
Yes, sir.
And guys, if you guys have any questions, just post something in the comments. You can you can send me an email at rlynchdpt@gmail.com. If you want to give your information, you can, man. But you guys can send me a question on my email. I'm not going to give out my telephone number for obvious reasons. But if you guys have questions, leave something in the comments or shoot me an email, and we'll go from there.
All right, man. Appreciate your time.
All right, bud. Good to see you, man. Take care.